Do your patients drop off after just a few visits, even when your care plans are solid? In this video, you'll discover how to deliver care plans in a way that builds deep trust, creates emotional connection, and keeps patients coming back long term. And stay with me because I'll share the single mindset shift that helped me transform one-time consults into loyal, lifelong patients. I'm Dr. Zac Watkins, and I've helped providers turn clinical expertise into full practices, not just by what they prescribe, but how they present it.
When we deliver care plans, a lot of the reason for this is maximum retention is the main thing. Now, I've commented on this on other modules. I just thought I'd add a little something here. The way that you deliver your care plan is, like I said, you're delivering a product to your patient. And forgive me when I use words like product and sales and things like that, but essentially when you're in the business world, you're trying to think of ways also that you're maximizing your production, but also giving value to your customer or your patients. Let me give you an example of kind of like what I would recommend providers do. Is we've talked about how we did labs usually on the initial visit, and the point of the initial visit obviously is to hear where they're at, to build that rapport, to build the trust, but you got to hear more about them. And ideally, they've already been vetted maybe by another team member or on a preset call, like a discovery call, so they know they're in the right place. Okay, so you're slowly walking them through the process. Now, when they get in, and again, I'll use me as an example just because it's easier that way. But when I meet with patients, and I meet them for the first time, it's a lot of rapport building, and I have the lab tests printed for them. If I had brick and mortar, if I did, obviously we show this on Zoom, but I also hand mailed some of the results in a nice looking package. I wanted to make sure every touch was perfection for them, so it made them feel elevated in their experience. I will say this: I think in this busy, over noisy world where everybody's looking for easy answers and fixes and everything, the way that you can stand out is you got to be very specific to who you're targeting, your ideal client, your ideal group, and the other thing is you just give them the best darn experience you can give them. You pamper them, you surprise them. I had team members that would kind of scour Facebook and just see what they're doing in life, and if something significant came up in their life, we always made sure we commented or sent a card or something like that. Just small things to show that you care.
Hey, real quick, if you're listening to this and thinking, I need some help building out something like this in my own practice, well, just scroll down and click the first link in the description. You can book a free strategy call with myself or my team, and we're going to take a look at what you are doing now, where you're stuck, and show you exactly how to build a customized care plan that works for both your patients and your business. All right, back to the video.
So as we're meeting with patients and I'm building a rapport and we're talking over their history and why they're here, where they've been, what works, what doesn't. The goal of this is to have them feel heard. You want them to talk and get out what they're kind of feeling. And this is where I think a lot of the getting to know your patient, how to communicate with them, is a very good tool. It's a very good talent to have, because you want to see how engaged they are with you. And once they start opening up, you can start hearing what they really feel. You can start hearing what they think the problem is. You can hear what they don't like about this industry, what's worked and not worked. You can hear what they're looking for. So then we'd spend time hearing obviously all that and then connecting them to their lab report. And for us, it was a comprehensive lab test with lots of things, inflammation, hormones, and things like that. If you guys are interested in what was in my lab panel, go ahead and comment or message me and we can talk more about that. But the reason of that was, okay, we go over it and we shared with them nutritional information, mineral, vitamin kind of things. And we didn't get caught up in the numbers and too caught up in the details. It was more about, yes, Mrs. Jones, I actually can see what you're saying. Based off this report, I can see there's some nutritional demand in related to stress. And this is what stress does. And you can go into that. So again, the first visit and that period of time for me was very important when it comes to delivering the plans, to deliver the value. Okay. I can look at a lab report and I can tell you what's wrong in 10 to 20 seconds, but that's not going to do good for a patient. that we got into this field to spend more time with them, to build rapport. And I'm not saying we do this to waste time or anything. I'm just saying a lot of stuff in functional medicine with patients is less about the medicines, less about the stuff that we give and the things that we do. A lot of it's them, it's connecting with them, it's being heartfelt, it's tying into their emotions, because this is us, this is how we want to be treated, which is why I think we're in this field, because we get to kind of serve people in a way that we believe that we know we can, but also connects with people at a whole new level, and it's extremely satisfying. So again, I wanted to comment on this. It's a good, the care plans, you are delivering them the most value. Treat them like your family. If you go in and say, this is my family member, I would not hold back. I would not worry about how much it costs. I would not worry about what they think about me, about my degree, or whatever it is. Just say, I'm here to serve you. This is what I see would best give you value. If you were my family, this is what we're doing. They can decide if they want to invest in that or not. That is not your decision. But being open and honest like that, I've said this before, but it just really gets a lot of buy-in and a lot of trust. And that's what's going to deliver maximum retention. When people trust you, they can open up to you, then you get to know them at a deeper level. And it all starts with those first visits, and it starts how you start presenting yourself, what you do, and how you can solve their problem.
Hey, before you go, make sure to hit that subscribe button so you never miss a video. If you like this one, you're definitely going to like the next video. So click here on the screen, keep going, and I'll see you over there.